Well, here we are again.
Here we are again.
Yes, hello, Dr. Salerno.
Hi,
How are you?
I'm good, Dr. Nadine.
So, we wanted to talk today about education
Mm-hmm.
and why it matters, and maybe also like introduce ourselves a little bit more, right?
Sure. Yeah.
People get to know us. I mean, well, me, I had a movie made about my life. So, lucky for you, that didn't happen for you. But,
Yeah.
so can you tell me, because I really don't know this, I'm genuinely curious, why
Yeah.
did you become a psychologist? Do you call yourself a psychologist? What do you call yourself? A therapist?
I'm a psychotherapist. Yeah. Yeah.
How'd you become a psychotherapist?
Originally what I wanted to do is, originally what I wanted to do is be a musician.
Oh, okay.
And then I decided, well, I'm interested in learning and teaching. So my bachelor's degree is actually in literature because I wanted to write and I wanted to, be like a college professor, be like a literature professor. Um, and then interestingly enough, I mean, family dynamics and relationships certainly contributed to this, but I started a master's program in literature. And one of the assignments, we had a critical theory course where we had to use a psychological theory to analyze a Shakespeare play. And that was actually my introduction to psychology, like academically.
How
Uh,
cool.
yeah. So I got so fascinated with that perspective that I actually dropped out of that master's program and applied for a master's program in clinical psychology. And then I chose an MS degree so that it could be a pre-doctoral degree because I knew I was going to want to pursue a PsyD or a PhD later on.
Yeah, yeah, you knew that. So you were young when you first went to like, so when you first,
Well, so I think I started the master's program process like 15 years ago.
okay.
Yeah.
Yeah,
And then, yeah, so then I started, and when in the master's program, they threw me into a practicum like the second semester of
right.
the program. So you just kind of have to start doing therapy, seeing clients at a site, and to help you kind of decide what populations you like to work with, what your strengths are.
Yeah.
And even at the time in my master's program, I wasn't actually convinced that I was going to pursue licensure and practice. I really wanted to teach psychology. I just kept
Oh,
back to the academic
yeah,
aspect
yeah.
of it. And then, but because you have to do the hours and you have to do the practicum, you kind of just start thinking, well, it seems like I have kind of a knack for this
Yeah.
and some, decent clinical judgment that could be enhanced through more education and practice. So I ended up deciding when I graduated from my master's to pursue licensure as a psychotherapist. And so then I did the 3,000 hours that you have to do, and probably
5 hours, people.
probably more equivalent to 6,000 hours if you consider all the time that you're off the clock doing
Yes.
notes and consultation. And
Yes.
I mean, that's how many you have to submit in order to test for the exam and to
That's right.
apply. But you do much more work around the clock in the beginning. And yeah, I just got a lot of really great experience. I worked at a lot of different sites and agencies, and had a lot of different supervisors and
Yeah.
people. So I mean, I would say that what I really was trying to do when I pursued that, maybe not fully consciously at the time, but I was trying to figure out my family dynamics.
Yeah.
And
Yeah.
I mentioned my maternal grandmother in my narcissism book and her relationship with my mother, and that was one of the most motivating factors to try to figure out, what's going on in my family, what's going on in my own mind, how am I responding to this?
Yeah.
What is this? Because nobody knew in my family what mental health or mental illness was. You know,
Right. Right.
um, if
Right.
if you don't go down that path, you really just you hear things here and there. I mean, back when I was growing up, everybody, there was war veterans had PTSD. Some people had nervous breakdowns, and then everybody else who was unstable was manic depressive.
True. That's
And
true.
it's
That's
and that
really
was
cute, by the way.
yeah, that's kind of the extent of of what people knew in popular media about like mental illness and what you heard about it. And of course, none of that is very accurate. Um, but so I just started really gravitating towards personality psychology. I just noticed I just kind of had a natural interest in that for some reason versus like other, perspectives and other theories.
Yeah, another
So
areas. Yeah. And so then you decided to get your PsyD.
yeah, so while I was interning at a dual diagnosis treatment center, I was working full time trying to get my hours completed and get good experience. And then I was also, in addition to that, pursuing a PsyD at night. So I would do an 8 to 5,
Wow.
yeah, 8 to 5
Wow.
therapy gig, and then go to the night school, and juggled that for about 3 years. And even with that program, I really was interested. The course that interested me the most was the personality theory and research. I just kept going back to that.
Wow.
Um, but I was taught in those degree programs from the perspective that we can really only understand personality through early development. So,
Right.
right. So there really wasn't a discussion about biological underpinnings
Not at all.
of anything. We didn't really discuss much. I mean, the program was great, and it was certainly scientific as far as like the psychological testing and all of that type of stuff, and the trauma. But there was sort of like heavy emphasis on theories that were created 100 years ago that we certainly shouldn't throw out, but the kind of theories that provided an explanation before they could even test the validity.
Yeah.
So it was just across the board accepted and understood, hey, if somebody has problems in their personality, something must have happened in their childhood that made them that way, and it's environmentally determined, and that was the end of the discussion. And you just kind of, you have to take that at face value.
Yeah.
Um, so
Right.
even my dissertation process, which was all about prenatal attachment influences, I
Mhm.
was like really, really interested in like the biochemical environment of the womb and development, and then how the mother and the father and the external system, how much that matters.
Yeah.
And so, but a lot of my research and support for that dissertation was based solely on environmental influence. There, I didn't even touch on the biological factors, and the genetic factors. So, as I started to progress in doing my private practice, and sitting with 40, 50 people a week, and really like you get that nuanced understanding of the differences of the clinical perspective. Not everybody walks in. A lot of people walk in and say the same thing, but they don't always know what's wrong.
Right. Yeah. Yeah. They just know that they don't feel right.
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 And so you do, 5 and 10 and 15 years of this experience. And I'm sure you had this experience too. And I'm going to ask you these same questions later, but your mind starts to shape and around this perspective and change. I mean, you're creating a mind as you're doing all of this training and education and this experience. It's not like you're really not the same. You don't have the same mind.
No, no, you totally change. Yeah. Yeah.
Right.
Yeah. We're constantly in school, I believe. That's when our neuroplasticity is really at work.
Absolutely.
Yeah.
Yeah. I
Yeah.
mean, so
I'm very different. I have a very different brain, thank goodness, than the brain I had going into school. Yes.
now we have the same traits and the same, and who we are is the same, but our perception of things has to change because you're programming yourself essentially to see
Yep.
things in a way that you didn't before because you didn't have the education and the expertise and the experience. So what I started noticing though is there were a population of clients coming to see me who were not responding to the interventions that have been shown to work for people with these self-reported problems. Like someone would come in and say that they were, they had trauma and they felt very ashamed and they had low self-worth and low self-esteem. And then typically there's ways to work with that. And the ones who really had those afflictions would get better, one way or another.
Right.
And then the ones who claim to have those afflictions and didn't get better, it's like, well, now what do you do? Is it, what are we missing? And so I started, all of my continuing education for years and years was dedicated to personality research. And then of course personal relationships with individuals who were extremely difficult, and me trying to figure that out and navigate that, because you're not immune to that when you're a clinician. um, you know, so I was trying to understand what I was possibly missing, and that led me to pursue a specialization in personality disorders and pathology and understanding that. And then I started stumbling upon research that's not taught in degree programs, just related to neuroscience, neurobiology, behavioral genetics. And there's this component that has been completely like ignored or dismissed, that really contributes to human psychology.
Yeah.
And that's what I just sort of delved into to help make sense of like kind of what the missing pieces were. And of course we don't know everything yet, but to a large degree, I like this idea that the environment determines everything. I mean, it's just not true. And there's this other big piece that I just really became fascinated by, and it answered a lot of questions that were unanswered in these other theories. And that's just kind of what I dedicated the rest of my career to, is understanding,
Yeah.
personality psychology. So,
That's why you wrote your book about it.
and yeah, yeah. So,
Yeah. Yeah, my journey was, it started, so my mother was very, very interested in psychology, and she was reading Freud and Jung in the 70s.
oh yeah.
She would say to me every single night at dinner, is it nature or nurture that shapes us?
Mm.
I'd be like, Mom, I'm 10. I do not give a shit about this,
Yeah.
but she was a
That's funny.
wonderful mother. I know, isn't that funny? And then that's the title of your book. So this was the question that was really, you
Yeah.
know, because she was raised by terrible parents. Her mother
Mm.
was a schizophrenic and her father was an alcoholic.
Oh
And she
boy.
was actually given up for the first 2 years of her life, and then they grabbed her again. And so
Wow.
she was a totally opposite mother. She was actually a really good enough mother, which is the miracle, right? Which just also goes to prove that it's not just environment.
Correct. Yep.
That right there's a prime example of it.
Yeah.
So I was always very interested in it. And then she put that seed into me. And then, I married my crazy ex-husband, the Wolf of Wall Street, and I put myself right into therapy
Mm.
because he was such a maniac and our life was so crazy. And I was 23 and I was like, I had enough humility to know I cannot manage this on my own. And I always believed that my therapist, unfortunately, back then, we didn't talk about narcissism or domestic violence, which now that we're having this conversation seems totally crazy because
Hmm.
that's everything I was dealing with.
Right.
I do believe she kept me sane because I do believe she allowed me to manage that whole thing. And I know I had a safe place to go to. And then I left him. And then at 38, I was meditating. I moved to LA and I said, I'm going to go back to school to be a therapist. Therapy saved me, and I just think it's a great thing. There's no ageism. I
Right.
love to learn. I'm such a nerd. So I
Mhm.
went to Pacifica Graduate Institute, which was incredible,
Mhm.
very Jungian, you
Yep.
know. They're missing a few pieces there, like we will get into that. But I went to school there for 5 years, 2 years to do my dissertation, 7 years. I got one class on domestic violence.
Yeah. Yeah.
Which is crazy.
Yeah.
But I learned so much about the unconscious and somatic psychotherapy and trauma and how trauma lives in the body.
Hmm.
And then as that was happening, what happened? So my ex wrote the book, The Wolf of Wall Street, and then the movie came out. And I never wanted a specialty. I was like adamant. I don't want a specialty. I want to treat everybody. I want to
Hmm.
treat couples. I want to treat mood disorders. I want to treat personality disorders. I don't know why I had that like stubbornness around me, but I did. But then all these smart, bright, beautiful women were coming into my office incredibly trauma bonded and
Yeah.
experiencing coercive control and betrayal. And also, I got my doctorate in 2015. And 2012-13 was when Jeffrey Epstein and Harvey Weinstein were in the
Mm-hmm.
zeitgeist.
Mm-hmm.
I did start to get really interested about these very disordered dark tetrad individuals
Yeah.
because I was so outraged by the level of abuse. And then when these women came in, I said, okay, let me go back to the research and see what is really happening. And that's when I learned about trauma bonding and intermittent reinforcement and dark tetrad. I started to get very interested in that. And then it just became my specialty. Now, you'd think it would have been obvious,
No.
but it just emerged on its own, which I think
Yeah.
is great.
I think that's wonderful. Yeah, I don't think, I mean, it's not always obvious. Just adding to that, all of those terms, those kind of colloquial terms that we have in popular media, which I actually think are very helpful to help make sense of things. I learned all of those because my my clinical expertise and my professionalism, people think this might be the case, but it's not the case that that translates into your personal life all the time,
Right.
you know? And so I actually discovered those terms because I had to get out of something pretty dangerous.
Okay.
Even after some of my education, it was in between my master's and my doctorate, but like about 10 years ago.
Yeah.
But it was I had to start reading self-help literature because the clinical literature was leaving out. It was saying that people only do things because they're traumatized over and over and over again. That's all I was. There was no explanation or even consideration of the possibility of like conscious and deliberate manipulation, coercion, conscious and deliberate abuse.
That's right. That's right. That's right.
So you have this toolbox of this expertise that works wonderful for trauma, but it
Yes.
does. But when you're trying to understand why somebody is intentionally mistreating people, there's a big gap there,
Yeah.
and you
Huge
know
gap. Huge.
yeah. So it's a gap that you mentioned depth psychology, and
Mhm.
that doesn't account for it. Psychoanalysis doesn't account for this.
No.
So the more
Cognitive
traditional.
behavioral doesn't account for it. We could name them all.
No.
Gestalt therapy, right?
Right.
Family systems, none of it.
And this is the issue that I think people are running into when even like someone like yourself who goes to a therapist to try to make sense of what's happening to them, and then the therapist is pretty much saying your attachment style, you're possibly codependent, you
Right.
possibly have unresolved trauma that you're projecting on and reenacting in this relationship.
Right.
Clean your side of the fence up, and then your husband is going to treat you like you
Yeah.
deserve to be treated. It's
Yeah.
like, and if he doesn't, it's only because he's wounded and he hasn't figured that out yet, that he's compensating for this wound. He's not doing it on purpose, by the way. He's innocent. He's just misunderstood. Right? It's like,
No.
oh my goodness. So I mean, maybe would you speak to that a little bit? Like, did you feel like you were getting validated in the beginning when you were going through all of that abuse?
I think I was just so happy to go to a space where nobody was judging me and I could just dump
Mm.
it all out. But I definitely think in the 90s, I was made to be responsible as a codependent person, which is ironic because I have avoidant attachment. So, it doesn't even make sense really in retrospect. But I think because his addiction was so extreme,
Mhm.
that everybody just was like, you're codependent and you're an addict. But I knew at some level that there was much more going on than that. It just wasn't that simple, but nobody was naming it for me.
Right.
And nobody was saying to me, your husband is intentionally manipulating you and gaslighting you and lying to you and controlling you, right? Because this is how he's wired.
Yep.
Nobody was saying that. And if somebody would have said that to me, I'm sure I would have responded very differently,
Right.
right? But that wasn't what happened at all. And not to say that none of it was helpful, but I think it
Right.
could have saved me years of harm.
Yeah. Yeah. Same here. I had those experiences too.
Yeah.
There was I wouldn't say it was an unwillingness, but I think it was just a lack of knowledge on the part of certain professionals that just they, even if a theory doesn't fit, they force it to fit. Like,
Right.
and what they can inevitably do, which I've noticed, which is really uh, unfortunate, is they might pathologize their patient even more by saying, well, there's
Yes.
something that you don't know about yourself. It's just unconscious. You haven't discovered it yet. It's
Yes.
like not
Yes.
not always. Like
Right.
maybe some people are doing things intentionally.
Yeah. Right, right, right. And of course, we know the unconscious is real, right? We're not
Yeah.
saying that it's not. And we
Nope.
do, unconsciously often reenact scenarios, right, with other people in our lives that are familiar from our childhood. But there's a lot more going, there's multiple causality there. And
Right.
I think we were trained to look at it through that lens.
Hmm.
That's why I'm so grateful for your work, because it's adding a different lens to it. And with that work, it does take the responsibility off of the victim.
Yeah.
And because there are psychopathic dark tetrad individuals that will use, harm, exploit, and betray us intentionally to
Hmm.
get their needs met.
Absolutely.
And that is really the truth. And so, but what I think is really important about what we do is that we had so much foundational education
Hmm.
that we could actually go off on our own curiosities and tangents in a very meaningful way.
Right. Absolutely. Yeah. I mean that educational foundation, like the formal education, like we said earlier, it really does shape and mold you in ways where you just wouldn't have been shaped and molded. So it's not, it's sort of, there's a reason why these, why that format exists. It's not to torture people. It's not because it's outdated or antiquated. Like, there's a discipline and a fortitude and a conditioning that is
Yes,
taking place, across all of those years. I mean, how long did we spend in school? Like,
7 years.
yeah, I
My
mean,
dissertation
yeah,
of 7 years. And then I took a postdoc training, a 3-year postdoc training in the neuroaffective relational model,
right, yeah,
which which is really works with developmental trauma, but also incorporating the body and more of somatic psychotherapy.
yeah.
And right, so looking at developmental trauma just through more of a nervous system lens.
Hmm.
And I found that very, very useful. But listen, I am a survivor, and as you are too, right? In different ways. But being a survivor is not enough to make you an expert.
No, absolutely. I mean, and case in point, what I just explained that to survive my situation, I couldn't rely on my clinical acumen and my judgment and my clinical expertise to escape from that because it doesn't translate, right? And people, I think, have a hard time understanding that. When we're talking about a trauma bond, we're talking about like a biochemical hijacking. It's not, you don't get to make decisions anymore. So it
Right.
doesn't matter how intelligent you are and how much of an expert you are, you you lose that ability to, uh, consent to staying or leaving, you know.
Yeah. No, you really do lose that ability. And I'm grateful too that there is so much information out there, right, about
Yeah.
trauma bonding, about personality disorders. And I love social media for that, but I do get worried that there are people talking about it that have great intentions,
Sure.
right? But to call yourself to proclaim that you understand the depth of traumatic responses and like this biochemical conditioning that we're talking about can be really harmful, because when the people come to us, they, especially if you've been abused, you are uncoercively controlled, you are in the most vulnerable
Hmm.
state.
Absolutely. Yeah.
And listen, and like we were saying earlier, that can even happen with therapists, right? You can go into a well-trained therapist, but this isn't their area of expertise.
Correct. Yeah. That's so important. And I just recently had, uh, I guess it was an argument, but I was trying to explain to another therapist the difference between scope of practice and scope of competence.
Mm.
So you're a licensed professional. You legally have the authority to diagnose every mental disorder that is a diagnosable disorder. You shouldn't do that unless you have a competency in that particular, disorder. So I don't work with schizophrenics. I don't have any business diagnosing one. I've never sat with one. I don't work with people on the autism spectrum.
Right.
If I wanted to go get extensive specialized training, I could, but I'm not going to. That's not my niche.
Right.
Um, but people have this idea that therapy is a one size fits all, and every therapist who has a credential can across the board know everything about everything, and that's dangerous. And I think some therapists kind of advertise themselves as a one, and even coaches, they advertise themselves as a one stop shop, and there is a completely different perspective from somebody who has spent over a decade specializing in personality pathology and somebody who has spent a decade specializing in ADHD. And
Correct.
those are not the same therapist, those are not the same expert. But if you speak with authority on something that you've extensively studied, like the dark triad, for example, and then somebody else took a class in personality theory 10 years ago, they sometimes I hear them say, "Oh, Dr. Nadine, this is what I heard. So you're getting it wrong." It's like, okay,
Right.
we're not trying to be superior, but we are different people because of our education in a lot of really good ways and our specialization. It's not, you can't compare somebody who's never been, through a doctoral program to somebody who's not. It's not even worth the argument because, you know, we're different people because of those experiences,
That's
right?
right. That's right. Yeah. And I mean, it's like if somebody came to me with an eating disorder, that
Hmm.
is way beyond my scope of competence.
Right.
I mean, and that's dangerous, right? That's the most life-threatening mental health challenge that you can really have. And so I would never take that on.
Yeah. Another thing I think is important is, I don't know if you get this kind of pushback, but people who say, because I have the disorder, I'm an expert on the disorder. What are your thoughts on that?
I'm trying to think if I have. Yeah, I might have had somebody say that, but not so recently.
Mhm.
Um, yeah, I mean, I know that that's not true because the way you experience it, someone else can experience a disorder in a multitude of
Right.
ways.
Yeah.
So I would never say that that's true.
Yeah.
Yeah,
Yeah. Because experience is not expertise, right? It's like, um, if you've ever done if you've done work in the addiction field, for example, somebody who is an addict doesn't necessarily know how to help other addicts
correct.
not become, they can't always help them into recovery just because they successfully recovered. And just like I use this example, sometimes I think it upsets people more than it should, but don't go to somebody who had cancer to diagnose your cancer. You go to an oncologist. Now, most people think, well, duh, no shit. But for some reason, psychology, there's this wiggle room to just hear anything and go to anyone, and there's no such thing as an expert because experience is expertise, and it's really bothersome because it really is a science,
It
you know.
really is. It really is. And, I had a woman recently who she came to me and she's dealing with a pathological personality. She's divorcing him. And
Hmm.
she went to an online parenting coach who, who said because she had divorced a narcissist, she was now an expert.
Oh.
Yeah. And so this woman came to me and she said, well, I saw this woman online and I was working with her, but everything she was telling me wasn't working. And I'm feeling very disorganized and dysregulated. And so I went over with what she was saying. She was like, what do you think? I was like, I don't think so. I don't think that's the answer. That doesn't sound like good advice. And so we had to redo so much damage
Hmm.
that had been done. And she's in a very precarious, scary situation. And
Yeah.
so, we offer this to our listeners because ask a lot of questions,
Hmm.
right? Figure out it's okay to go to somebody who's an expert, a coach, a professional therapist, and say, how many years did you go to school? What
Mhm.
exactly did you study?
Mhm.
Why is this your specialty? You
Yeah.
know, how did you come to make this your expertise?
Right.
I think people get intimidated when they go to a coach or a therapist.
Yeah. It's sort of like going to a medical doctor and just assuming they know how to cure everything. You don't question,
Right.
but you should, because oftentimes this is a totally different topic, but general practitioners prescribing psychotropic meds when they've never taken a course or a specialty, I mean, they have the legal authority to prescribe medications that they don't even know
Right.
anything about. I mean, that's dangerous, but people think, well, I can't, my doctor knows. My doctor knows.
Right.
So I think personal experience certainly lends itself to an empathy and understanding,
Yes, for
but
sure.
that's not. I mean, that's not enough to call yourself an expert in the field, right?
Yeah. Yeah. And I have my community, which you spoke at, and the women just love you. And I run a support group in there. And let me tell you something. Thank God I went to school for 7 years, okay? Because all the different cases and all the different questions, right? So some women come at me with a certain attachment pattern, certain personality traits, a
Yep.
very different perspective, maybe been in therapy, some never been in therapy, and they're throwing all these questions at me. And if I did not have that foundation, and still that doesn't mean I'm perfect and I answer everything right, I don't. But if I did not have that foundation of all of this clinical expertise,
Right.
the theory, the foundation, learning about all different theories, because different ways of being work with different people,
Yes.
I would be, forget it. There's no word for how it would be for me to answer these women.
Well, I think when we don't have that expansion of the insight and the awareness and the way that you train the mind to think psychologically, what happens is we default to our own experience and then we just project it. So
Yes, that's it.
we tell people what would work for us, assuming that everybody else is, and that's dangerous, not because it's intentionally dangerous, but your journey is not mine,
Right.
and the person who you're going to, who you're spending your time and investing your money and taking a chance on to help you, they need to know that. They need to know that they can't just say, well, I know for me this worked, so go do this. You could really hurt someone if you give that
Oh,
kind of
that's the
advice.
best thing you said, right? Like when and if I do come from my own bias, I always state it.
Right. Or you ask for permission. May I
I
self-disclose
ask,
something
yes,
because I think
yes,
it might be helpful for you. I'm not saying do it or this is
yes.
what's happening, but yeah, right.
Yeah, I always say, do you mind, would it be okay if I shared
Right.
something?
Right.
And then I say, and I'm gonna, or if I say to them, this is purely my own bias and I'm gonna own this right now,
Yeah,
right? Because, right, we have to look at them much more objectively,
absolutely.
not project all of our own experience onto them.
And we're not conditioned to think objectively in life. So that's why we need our training.
Exactly. And it took us 7 years to think objectively. And I
Oh
still
yeah.
have to catch myself, right? Because when you're
Right.
working with somebody, you're kind of split intentionally as a therapist, which is different than splitting, but
Yes.
you're kind of, split where, you're hearing them, listening to them, attuning to them, and then you're observing that through the lens of theory.
Correct. Yeah, we have the observing ego and then we have the interaction that's taking place. It's a dual
Right.
process for
And
us.
that takes practice, like almost like
Oh,
learning to play the piano,
right. Absolutely.
to be able to hold those two things, witness yourself, witness them, and hold the theory is a lot.
And yeah, that's like that takes conditioning and form, almost like what's coming to mind is like a martial art. Like you can't
Yes,
you can't do the move once and then go and protect yourself in a fight. You have to do those forms and those maneuvers over and over and over again to where it becomes automatic and autonomic. And that's I think another thing that people don't understand about the training we have is we put in countless hours so that that becomes more of an automatic process for us,
yes,
and that informs everything that we say.
yes, everything that we say. And you have to be so mindful about what you
Mhm.
say and what I loved about my NARM training, especially, was that it made me so curious.
Mm.
And my teacher, Dr. Heller, he really made us aware in the training when we were using the client to get our own needs met.
Mm. Wanting something from them?
Yeah, or just like needing something from them.
Yeah,
And
yeah,
he
yeah,
would
yeah.
call us on it every single day.
Yeah,
That was really important for me
absolutely.
personally too, because of my psychological makeup.
Sure.
Yeah. And
Yeah.
that's so there's all these nuances to being a therapist.
Well, and you're kind of moving into like the counter transference realm, which is really important too, because people, human beings are still going to have responses and reactions to people, but it's what you do with it that matters. And again, your training informs what you do with it, because sometimes if you're not conscious of it, you can't see it, right? So it's not that there's something wrong with wanting or needing something from someone. It's that this isn't the forum for that to take place. So you note it, and then you pivot, you redirect.
Right. That's right.
And I mean, there's just, when you really think about it, this kind of work is the compassion and empathy fatigue you have. It's because we have to do all of these things in milliseconds. It's
Yeah.
this is it's an art and a science and a skill set that I think kind of goes over people's heads when they think anyone can just do it naturally. I don't believe, even if you have a natural gift or inclination to be this way, you still need to harness that
Yeah.
through
Yeah.
through training.
What's that theory? 10,000 hours, right?
Yeah.
To be really good at something, and especially this, you have another human whose life you're helping, like it's in your hands. Now,
Right.
of course, we give them agency and it's their,
Right.
and they make the final decision, but people are very vulnerable. They're coming to you usually on their knees, right? And like you're saying, we're making these very attuned, informed decisions in milliseconds.
Right.
And it really is an art to be able to do that.
So, what would you recommend people who, they go down the rabbit hole of information education on narcissism, the dark triad, like
Yeah.
basically people who intentionally coerce and manipulate and exploit, who are in a situation, what should they look for in a professional or a support system?
Yeah. Yeah, I think especially for somebody like this, you need to go to somebody who understands severe personality pathology,
Right.
who is an expert in narcissism, the dark tetrad, trauma bonds, coercive control, someone who has made it their work.
Right.
I do believe that because I get so many women who have been re-victimized, and not just by personal therapists, by couples therapists. That's why I really love Terry Real's work, because he said if a couple comes into you, and of course most couples come because they're arguing, find out who has the power
Mm, wonderful. I love that.
and figure that out, because what he says is you have to have a bias
Yep.
if somebody's being abused, where a lot of couples counselors will just be like, no, I don't have a bias, and they'll try to work with both. So this training is very nuanced.
Yeah, I love that idea. Is like you have to have a bias if only one person has the power. If there's not equality, then a bias is necessary. Yeah,
Yeah. Yeah.
that's
So
great.
I do think that it's really important that, you search out people like you or I,
Mhm.
go to them, because also your healing will be a lot more effective and a lot quicker.
Right, because this is really all we do now. I mean, this is our
Yes.
it's not like we are dabbling into a whole bunch of other things. Like this is our primary focus. We continue our education personally and
That's right.
professionally dedicated to the research on this. So um, finding somebody fine-tuned in that regard, I think is really important.
I think it's really important too. And I just love having these conversations with you.
Yeah, me too.
I
I'm
learn every single
having fun.
time I have one.
Me too. Yeah.
Okay, so tell everybody where they can find you on Instagram.
Okay. My handle is at Dr. Peter Salerno.
Okay.
Yeah. And then
And I'm at the Real Dr. Nadine.
real Dr. Nadine.
Yes.
Mhm.
And tell everybody the title of your book. You have two books.
So the nature and nurture of narcissism kind of is about uh, debunking some of the myths and misinformation about the cause of narcissism and an alternative perspective from recent research. And then the other one is traumatic cognitive dissonance, which is sort of another way of talking about trauma bonds
Yeah.
and kind of how to recover from them.
Yeah, I just got that one again because I left it in Florida and I
Oh,
needed it.
oh, thank you.
So I purchased it twice now.
Thank
Yes.
you for
And my book is Run Like Hell, A Therapist's Guide to Recognizing, Escaping, and Healing from Trauma Bonds.
which I highly recommend because I couldn't put that book down. Honest to God, you can ask my wife. I dedicated my weekend to it, and I was very impressed with how much thought you put into. I could tell that you put things in and committed to them after you did your due diligence. It wasn't just your opinions. So that's really
Research based,
impressive. And
very research based. Yes.
yeah,
And that's where a PsyD and a PhD come in because
right.
we learn how to research. We have
That's right.
how to research.
That's a skill too. Absolutely.
Skill. All right, Peter, this was lovely.
All right. Take care. Thank you.